Navigating the United States Department of Veterans Affairs healthcare system can sometimes feel overwhelming. One of the most important concepts for any veteran to understand is the VA priority group system. When you apply for VA healthcare, the VA assigns you to one of 8 priority groups. This system is the VA's method for making sure that all enrolled veterans receive fair and timely access to medical services. It helps the VA manage its resources and ensures that those with the most urgent healthcare needs, especially those related to their military service, can get the care they need as quickly as possible. Knowing your assigned group is the first step to understanding your healthcare benefits. The fundamental purpose behind these priority groups is to create a structured and equitable process for enrollment. Since Congress may not always provide enough funding to cover care for every single veteran who applies, the VA must prioritize. This system ensures that veterans with service-connected disabilities, lower incomes, or other specific qualifications are given higher priority for enrollment in the healthcare program. It's not about valuing one veteran's service over another's. Instead, it is a practical approach designed to serve those who were injured or made ill by their service first, followed by other categories of veterans based on need and specific eligibility criteria. Think of the priority groups as a tiered system for signing up for healthcare. If you are in a higher priority group like Priority Group 1, your enrollment is practically guaranteed and you will face fewer, if any, costs for your care. If you are in a lower priority group, your enrollment might depend on the VA's current capacity and funding. This can affect how soon you are able to sign up and what you might have to pay for certain services. Understanding this structure helps you set realistic expectations about your VA healthcare journey and empowers you to know what benefits you are entitled to receive. Knowing your priority group is not just a piece of administrative trivia, it is crucial information that directly impacts your healthcare experience. It determines your eligibility for enrollment, your potential out-of-pocket costs for co-payments, and sometimes even your access to specific programs or treatments. By understanding where you fall within this system, you can better plan for your healthcare needs and advocate for yourself. It gives you a clear picture of your benefits, helping you make informed decisions about your medical care and financial planning for the future. The VA uses a specific set of criteria to determine which priority group a veteran belongs to. This process is standardized to ensure fairness and consistency across the board. The primary factor the VA considers is your military service history, with a major focus on whether you have a service-connected disability. The VA assigns a disability rating, expressed as a percentage, to conditions that were caused or made worse by your active duty service. A higher disability rating will almost always place you in a higher priority group, reflecting the nation's commitment to caring for those injured while serving. Your service record and disability status form the foundation of your priority group assignment. Beyond your disability rating, your income level plays a significant role, especially for veterans without service-connected conditions. The VA compares your gross household income to established income limits, which can vary based on where you live. These are known as geographically adjusted income limits. If your income falls below these thresholds, you may be placed in a higher priority group than a veteran with a similar service history, but a higher income. The VA also considers whether you are eligible for other programs like Medicaid or if you receive other benefits such as a VA pension, which can also place you in a higher priority category. Several other special circumstances can place a veteran in a higher priority group. For example, being a former prisoner of war or a recipient of the Purple Heart or Medal of Honor automatically places you in a high priority group, regardless of other factors. Similarly, veterans who have been determined by the VA to be catastrophically disabled or who receive VA benefits for aid and attendance or housebound status are also assigned to a higher group. These special eligibility categories recognize unique sacrifices and severe needs, ensuring these veterans receive the highest level of access to care. It is important to remember that if you qualify for more than one priority group, the VA will assign you to the highest one for which you are eligible. For example, a veteran might have a 10% service-connected disability, which is Priority Group 3, but also have an income low enough to qualify for Priority Group 5. In this case, the VA would place them in Priority Group 3, as it is the higher of the two. This ensures you receive the maximum benefits you're entitled to based on all of your qualifying factors, from your service history to your financial situation. The VA's 8 priority groups are organized from highest to lowest priority, with each group having specific eligibility criteria. Priority Group 1 is for veterans with the most significant needs. This includes veterans with a VA disability rating of 50% or more, those deemed totally disabled and unemployable due to service-connected conditions, or recipients of the Medal of Honor. Veterans in this group typically do not have to pay any copays for their VA healthcare or prescriptions. This group represents the VA's highest commitment to those most affected by their military service, ensuring they have cost-free access to comprehensive care. The next few groups also focus on veterans with service-connected disabilities. Priority Group 2 is for veterans with a service-connected disability rated at 30 or 40%. Priority Group 3 includes a broader range of veterans, such as former prisoners of war, Purple Heart recipients, veterans with a disability rating of 10 or 20%, and those discharged for a disability that was caused or worsened by their service. Priority Group 4 is for veterans receiving aid in attendance or housebound benefits from the VA, or those the VA has determined to be catastrophically disabled, recognizing their need for significant ongoing care. Moving down the list, income and other factors become more prominent. Priority Group 5 is for veterans with no service-connected disability or a 0% non-compensable service-connected rating, but who have an annual income below the VA's established limits. It also includes veterans receiving a VA pension or those eligible for Medicaid. Priority Group 6 is a large and diverse group. It includes veterans with a 0% compensable service-connected disability, World War II veterans, and veterans with specific environmental exposures, like Agent Orange in Vietnam, or service in the Persian Gulf War, as well as recent combat veterans. Finally, the last two groups are primarily for veterans without service-connected disabilities whose income is above the VA's lowest thresholds. Priority Group 7 is for veterans whose income is above the VA pension threshold, but below the geographically adjusted income limit for their area. These veterans agree to pay co-pays for their care. Priority Group 8 is for veterans whose income is above both the VA and geographic income limits. Their enrollment is dependent on VA resources, and they are also required to pay copays. Not all veterans in Priority Group 8 may be eligible for enrollment at all times. Understanding your assigned priority group is essential because it directly influences your VA healthcare experience. First and foremost, it affects how much you will pay, if anything, for your medical care. Veterans in higher priority groups, particularly groups 1 through 4, often have very low or no co-payments for inpatient care, outpatient visits, and prescription medications. In contrast, veterans in lower priority groups, such as 7 and 8, are typically required to make co-payments for most of their care. Knowing your group helps you anticipate these costs and budget accordingly, preventing unexpected medical bills and financial stress down the road. Your priority group also determines how quickly you can get enrolled in the VA healthcare system. The VA is required to enroll veterans in the highest priority groups first. While the VA strives to provide care to all eligible veterans, enrollment for those in the lowest priority groups, specifically Priority Group 8, can sometimes be restricted due to funding limitations. If you are in a lower group, it is important to be aware that there may be waiting periods or temporary freezes on new enrollments. Staying informed about the current enrollment status for your group can help manage your expectations for accessing VA services. It is crucial to remember that your priority group is not set in stone for life. It can change if your personal circumstances change. For instance, if you are a veteran in a lower priority group and the VA later grants you a service-connected disability rating or increases your existing rating, you will be moved to a higher priority group. Similarly, a significant change in your annual household income, whether an increase or a decrease, could also lead to a reassignment. Because of this, it is vital to keep the VA updated on any changes to your disability status, income, or other relevant life events. The best way to stay on top of your benefits is to be proactive. If you are unsure of your current priority group, you can find out by contacting the VA Healthcare Enrollment Coordinator at your local VA Medical Center or by calling the VA's main helpline. You can also find detailed information about each priority group, income limits, and co-payment rates on the official VA website at va.gov. Taking a few moments to confirm your priority group and understand what it means is a powerful step toward taking full control of your health and wellness as a veteran.